Hi there everyone, how are you today? I'd like to talk to you about something called a C-section or Caesarean section, which your doctor may have recommended for you. You might be wondering, what is it and why do you need it? Well, a C-section is recommended for pregnant mums who are about to give birth to their baby, and it can be for a whole lot of different reasons. So, for example, it could be that the baby is just simply too big to fit through the pelvis for a natural childbirth, or the baby could be normal size, but the pelvis is too small, so the only way to get the baby out is via the stomach. Can be other reasons. For example, the umbilical cord could be wrapping up around the baby and causing all sorts of complications, stressing the baby, and the doctors looking at a fetal heart monitor and deciding that the baby needs to come out as quickly as possible. Sometimes the baby's head's in the wrong position, so instead of being down the bottom where it should be, so it can go out, the head might be up here and it might be feet first. There can be other reasons. Also, sometimes the placenta is here down in the wrong position, blocking the exit for the baby, or there could be cancers in the uterus, which mean that it might be safer to remove the baby via the C-section. Your doctor will talk through these options and issues with you. A number of mums decide to it's elective surgery, so sometimes the mums will just book in a C-section, then they know exactly when they're going to be giving birth, and so that's also common as well. Now, what's involved with the actual C-section operation? That's what I'm going to talk to you about today. First, probably the most common thing is what's going to happen bladder-wise. Well, your doctors will actually connect you to a catheter, your bladder, and then they will run a little tube out, so you don't have to worry about little accidents happening during the procedure or your childbirth. The other thing, of course, which is very common, is mums concerned about pain during childbirth. So the doctors want to minimize the pain, so there's two options with anesthetics. One is a general or a local. The general is a lot less common and used for emergencies usually, because that would obviously make mum unconscious and baby unconscious as well, so much less common. More common is the local anesthetic, which is usually given via a needle at the lower part of the spine, which will make everything numb below that needle. And so when the doctors are all ready and the anesthesia is working, mum's still conscious, of course, and the benefit of the local one is baby's still conscious as well. They'll then clean the skin here, and they've got to go through about 7 layers to actually get through to the baby during the C-section. So first they'll make a 10 to 11 centimeter cut along the stomach here, just above the bikini line. Then they'll go in through the fatty tissue, another slice there. Then they'll get down to the connective tissue, another slice. Then they're down to the muscles. Now, they won't cut the muscles. The doctors will just pull the muscles apart, and then they'll get to the peritoneum, so they'll slice through there. Then they're into the uterus proper, so they'll slice into the uterus either vertical or horizontal. Then they can see the baby, which is in a sac called the amniotic sac. They'll puncture the sac, and they'll carefully take the baby out, wrap the baby. They will clip the umbilical cord and cut it, and then they'll carefully remove the placenta. Then the doctors will go about carefully stitching and sewing and stapling mum up to get her back to normal. Mum will go into post-op. Mum will stay in hospital for around 5 days, and mum will be encouraged to breastfeed and develop her relationship with baby. And that is the basics of a Caesarean section or C-section.